this to the computer. Okay, so back to the question about melatonin. So melatonin can be used as a sleep aid because what melatonin does is help you fall asleep. It doesn't help you stay asleep, but it does help you fall asleep. So if you're not able to fall asleep, then you can use melatonin to help you fall asleep. But if, oh, I fall asleep really well, but I wake up 2 hours later and I can't get back to sleep, then melatonin really isn't your solution for sleep. You need to use some valerian root. You need to look at glutamate levels. You need to look at what's waking you up if it's pain. You need to look at possible adrenal dysfunction. That can wake you up in the middle of the night. There's some other things too that we want to address. But then the second part of the question is, can you use melatonin as a cancer killer? That's only with high dose melatonin. So you'd be using, I typically start people with 20 milligrams before bed, and then you bump up to 40 and then to 60 milligrams before bed. That's the typical dosage for melatonin to use. It's not a cancer killer in itself, but it can aid the uptake of everything else you're doing into the cells sometimes. I know some doctors recommend it with all their cancer patients. We don't recommend it with all our cancer patients. We test people on it, but it's certainly something you can add. And it will help with sleep. So there isn't really any known side effects of high-dose melatonin. Typically, people get used to it, and then once you're taking that high dose, it ends up working as far as sleep help goes, similar to if you just took low dose. But the high-dose melatonin we have in our store too. That's the highest dose that we have found comes in a 20 milligram capsule. But if someone is just trying to use melatonin to go to sleep, then you would use a smaller dose. And what we use is a product called Insomnitol, because it has melatonin and valerian root and some other things to help calming and reduce glutamate levels and just relax you and help you fall asleep that way too.
It seems like 20 grams or higher would put someone in a coma, because wow.
Yeah, it really doesn't. It doesn't make you more sleepy, because as far as how melatonin works on your brain, you have a kind of a limit on what you need and what you'll use. So if a person was using melatonin just to go to sleep, 20 milligrams would just be a wasted dose.
Oh.
So you typically start with 3 milligrams and maybe up to 6 or 9, but typically people just for sleep purposes don't need any more than that, and if they took more, it wouldn't help them anymore. Well, I put a picture of Disney World there. You can see that, right? Because we just got back from Disney World. Just got back quite a while ago. And somebody asked me, about Disney World. We go down to Disney World a lot because when our kids were little, that was a good place to get them lost, and we could find them at the end of the day. No, just kidding. We just got back, and it is magical. And if you've been there, you know what I mean. And again, we've been there a lot when our kids were younger. We'd drive under that magical arch on the way, and the kids would scream like they're entering the land of milk and honey. So it was kind of fun. All the kids would scream, "Yay, we're at Disney World." And it was very magical. They even have magic bands that you wear at Disney World. If you haven't been there lately, that's kind of a newer thing the last couple of years. And they're the keys to your room. They're your tickets to the park, and you never need to carry cash or a credit card. It's just magic. You buy something at the gift shop, and yes, they do have gift shops in Disney World, just so in case you didn't know. And I remember the first time we came out, when I bought my first set of Mickey ears, to pull out my wallet, they said, "No, sir, you just need to use your magic band." So tap the magic band down there, and voila, it was just magic.
Do the kids get a magic band and they can
Yes, that can be the dangerous part because the kids get it too. And it's just magic. But I tell you, what wasn't magical was Disney figured out that they must have put like a tracker on that little magic band. So once you crossed back out through the magical arch and left the land of milk and honey, ding, your credit card gets melted right there in your pocket, just melts all over your leg. Plastic goo seared through.
They know what they're doing.
Few layers of epithelium on my right thigh. It was just magical. So, yeah, somebody asked, what's it like going to Disney at Christmas time? Isn't it really crowded there? And I said, well, you want to practice. If you're going to go to Disney at Christmas time, practice. Start by just going home and fill your living room chest deep with mashed potatoes. And then pick a spot on each side of the wall and wade back and forth across your room through the mashed potatoes. And that's what it's like going to Disney World at Christmas time.
Like China.
Yeah, kind of like that. And actually, if you find yourself that it's pretty easy to breathe and you can see where you're going, then you don't have enough mashed potatoes. That's what it's like going to Disney World. So why we like going to Disney World, I still haven't figured that out. Some genetic defect I have that leads to insanity. All right, enough about Disney World. I don't have any other slides but so we'll look at this while we open up for more questions.
Hi, Dr. Connor. This is Thelma. Can everybody hear me?
Yes, Thelma, go ahead.
Okay, cool. All right, so this is the first time I've joined Zoom. I haven't been able to get on the right schedule, so I'm happy to be here.
I'm glad it worked for you this time.
So two things happened. Yesterday I had my mercury, one quadrant of my mercury fillings taken out.
Oh,
and
wonderful.
At the same time, a doctor took a CAT scan of that area and tells me I have some more work and encapsulations or whatever that has to be cleaned out. So, and then today I just came back from a technetium stress test for my heart. And so I feel like I need to detox, and I don't know what to use.
Okay, so let's talk about that. So when a person has their mercury fillings removed, even by a biological dentist who's doing it right with the mercury vacuum and rubber dam and cannula, all other things that they will use to protect you from exposure to those mercury vapors that they're drilling out of your body, you do want to then use a chelator afterwards. So a chelator will help grab onto any mercury that is spilled into your body, because you're going to spill some. And if they're giving you a sedative of some kind, even if it's Novocaine, you want to detox that too. So we typically tell people to use the product Chelex, but we can't use Chelex is a product by Zymogen. And remember, I talked to you about the Zymogen products that we had to private label them because they don't want them sold online anymore. So the private label name is Cheliclear. And that is just a chelator. So a chelator is a nutritional substance that grabs onto toxins and helps pull them out of the body. The other thing a person could use is helping with liver detoxification, which is go back to our first question, which was, if I have some mass in my liver area, how do I help detox the liver? Well, that's where you could use coffee enemas. That's where you could use castor oil packs over the liver. That's where you could use milk thistle, PON1 Assist, which is a product that helps assist that PON1 pathway. The PON1 pathway is specific for how you detox many heavy metals. Curcumin can be a good benefit also for helping liver detoxification. There's some other herbs that I could think of if I spent a little more time on that, but definitely using a chelator and helping with liver detoxification. Primary one is coffee enemas.
Okay, so I'm on the Chelex, one twice a day. Should I just double that?
No, I would just stay on that. That's plenty of dose for that.
Okay, and I did the castor oil and the iron cleanse last night.
Good. So the iron cleanse, I forgot to mention that. Also helping with other detox portals like saunas and things like that would be helpful too.
Okay, and how often, should I be doing? I do the milk thistle already. I think I'm on PON one, and
Yeah,
definitely.
so you might be covered just fine. And as far as how often you could do the foot bath, you could do that every day.
Okay. All right. Thanks.
Yep. And if you do have a sauna, you could do that every day too.
Okay.
All right. Next question.
Dr. Connors.
Huh?
This is Donna.
Hi, Donna.
Oh, hi. I pray for you every day.
Oh, thank you very much.
I have several questions today. One is my calcium went really high this last blood draw that I had. Could that be from food intake? Anything that has a calcium, like cheese, milk, et cetera, anything that has calcium in it? Could that be keeping it high? Or is it because it's taking it out of my bone?
Most likely it's taking it out of your bone. If person does not have any sort of cancer and they, go and eat a whole bunch of calcium and take a whole bunch of calcium supplements, they still won't have high blood calcium. So calcium levels are regulated by your kidney. They're regulated by your parathyroid hormone. And so blood calcium levels from dietary sources won't push your calcium levels high. So when a person has high calcium levels, you think of, if they don't have a history of cancer, you think of parathyroid disease. And if they do have cancer, you think of bone loss. So then we go to how are we going to keep that calcium in the bone and keep decreased destruction? There's not a lot of data out there on that. The only data that I found is EGCG from green tea extract will help that, because what's going on at the site of the cancer in the bone is a what's called an osteolytic reaction, meaning the bone is getting broken down. And that is what goes on at that time. And not to get too specific, but there's a specific cytokine immune chemical called immunoglobulin, or IL-6. It's a cytokine, and IL-6 levels can be lowered really only by green tea extract. So okay. I think, aren't you already on EGCG?
No, I'm not.
Are you on TVgo?
Nope.
Okay, we should add that to your protocol then. So we used to use our clear EGCG, but the more studies I've done on the sourcing of green tea extract, it's so important, because one study I saw is that every source that they found was tainted. Green tea happens to be something that picks up toxins from the soil and the environment more readily than just about any herb that's grown, and virtually all the green tea sold in America is from China. And the only company that I currently trust that sources their green tea for their EGCG green tea extract and is completely crazy anal about testing it and the purification of it is US Enzymes. So US Enzymes TVigo, which is a newer product that they started with, is the best source and the most readily available. So I would take that, and I would do probably 3 a day to start with.
Okay. All right. Yeah, because it jumped to 11.9.
Yeah, we got to drop that down. You got to really make sure also that you're just gulping water so you're flushing your kidneys out.
Right. Well, I do that because I've had kidney stones that had to be removed. So,
Yeah.
Okay. The next question I had is loss of weight. I've lost quite a bit of weight, and I can't afford to lose any more weight. And I was just wondering, is it because my food and the nutrients are not being properly absorbed into the body?
Can be. That's part of it. Have you watched that video on cachexia?
Yes.
Okay. So yeah, part of it is that. So if a person has gut issues and they're not absorbing their food very well, their nutrients very well, then they're not going to be getting the value from the food that they're ingesting.
Mm-hmm.
So that can be a component also. So, making sure that you're, helping with prebiotics and probiotics to help gut health can be important as well. Make sure also from that cachexia video that you try to do some exercises to stimulate muscle mass growth.
Yep. Do that.
Because the concern with weight loss in cancer is that the cancer is utilizing is making glucose from the protein in the muscle.
Yeah. Yeah.
So the way to beat that is to have the muscle call for its own need, so that your body will say, oh, well, we can't take this muscle mass because she's using it. And that can slow down the cancer growth. So doing some weights, lifting, doing some exercises could be your best friend.
Yeah. Yeah. I do those. And I'm active. I'm not, one to, sit around or anything.
Okay, good.
I'm active during the day. Usually after dinner, though, I kind of rest. The third question I had is about moles that are not looking really well. I was wondering what your thoughts are about having them surgically removed, cut out, if that's going to produce circulating tumor cells.
Yeah, so
obviously we don't know if they're cancer or not, but the risk is always there.
Yeah, I have a very strong opinion about surgical removal of possible skin cancers. I am very much against it. I mean, if you have a basal cell cancer, removing a basal cell cancer, I don't see really any harm in that. But a basal cell cancer is pretty easy to identify. It's typically kind of shiny and raised. And it looks like a flat raised surface with a little bit of a sheen to it, versus something that is darker usually, and looks more ominous. That could be a squamous or a melanoma. And if you remove that, the way that is done at a dermatologist's office, they're not going to just remove it. They're going to do what's called a Mohs surgery. So they'll cut around it, everything that they can get the visual edges, and they'll send it to the lab immediately and say, well, it has clean borders. No, it doesn't have clean borders. If it doesn't, they go deeper, and they keep going until there's clean borders. You know that.
Right.
I think that there's really there's a lot of dangers to that. That is the fastest way to spread a melanoma.
Yeah.
You'd be much better off using either essential oils on it to kill it. I've had patients that use some different essential oils, some oregano oil and frankincense on it to kill it. Otherwise, the treatment, if you really believe that it's a possible melanoma, the other treatment is black salve. And we made a little video on black salve a few weeks ago, Michelle and I, in a Members Minute video. We've used black salve on numerous patients with melanomas, and it's the only way to go. It can be very painful, but it's the way to go.
Yeah. Okay. Yeah. Right now I'm putting out like this eggplant.
Yep. That's another treatment for it too.
Yeah.
Yep.
Okay. All right. That's all for now. I've found I've been looking at bromelain. Are you familiar with bromelain? It's from pineapples.
Yes. So that's an enzyme. Yep.
For pain.
Yeah. So you can use enzymes for pain. Some people it helps. Some people it doesn't. That is another choice. What's your pain level been at?
Right now, the only pain I have is in my knees. It started back in April, and I've not been able to. It's been continually getting worse at times. I went to the chiropractor. It helps some, but I really think it's more in the nerves than it is in the muscles. And I've not found anything to really help, and I'm not going to take Tylenol. So
right.
I just live with it.
Yeah, it's hard. Have you tried things like hot and cold packs on it and a TENS unit? That's another possible help for pain.
Yeah. I've used the TENS unit, and I've also used hot and cold. It only lasts for the TENS unit only lasts for a short time.
Yeah.
But anyway, I'll make it through. I am just blessed beyond the past 3 years of being almost 4 years now being diagnosed with cancer and really having no pain issues. I hear everybody on here that has to suffer with pain issues, and my heart really just breaks for them. And I think what I got to complain about? I got 2 knees that bother me when I walk, but I can live with that. The Lord's been very good to me.
Well, it always is the most beneficial if we just try to, even though it's so difficult times, just to count our blessings.
Yeah.
And try to just focus on what's good, even though it's hard to see that sometimes when we're in a lot of pain or we're really struggling.
Right. Well, thank you for your time.
All right. Any other questions?
I have one if nobody else does.
Go right ahead.
I guess on the subject of chemo brain, and I just been thinking, I've seen some commercials, and then I've seen some Shark Tank episodes about supplements that are like for focusing and help with memory and just kind of help concentrate. Is any of that legit? Is there anything out there that really does work?
Yeah, there really is. We used to do years ago. I used to see a lot of brain-based patients. One of my degrees is in functional neurology, so we used to see a lot of ADD, ADHD, Alzheimer's, Parkinson's, dementia patients. And the brain nutrients can be extremely beneficial. There's a lot of them out there. We created one called our own mix. There wasn't one that had everything in it that I want, that we call our brain anti-inflammatory mix. That's called BAM, and it's a powder similar to the mushroom powder if anybody takes that, but it's totally different ingredients, and it's for brain inflammation. We have numerous products in our store for that. Premier Research Lab has a really good one. I think it's called Cereven. That's what it is. Cereven. Cereven. That's for like an aging, as you age and you have memory loss, but it's still the same herbs, whether it's chemo brain or not. Some of the standard process has some with individual components, and those are like Bacopa. Curcumin can help. So anything that's going to help detoxify the brain and help decrease inflammation in the brain is beneficial. So yeah, those herbs can help. It's always the source of the herb, and people react differently to different herbs. So if you purchase something, you try it, and boy, this isn't really helping, try something different, because you will land on something, wow, this really helps, it really clears my mind. We have lots of patients that are taking BAM, and we have lots of patients that take the Cereven that just swear by it too. So those herbs do help.
And those would even help for like non-cancer patients?
Yeah, yep. They really were not meant, they were not made for cancer patients. But it's for that, just that memory loss. Whether it doesn't make a difference whether it's caused from the chemo or whether it's caused from glucose levels with diabetes, or whether it's caused from just degeneration from toxicity and early Alzheimer's.
Why would a young person have those issues then?
Why would a young person have those issues? Well, the biggest reason why young people have any brain issues, ADD, ADHD, has to do with toxicity, has to do with vaccinations that they received, reactions to vaccinations, because they have specific detox pathways where they don't get rid of those adjuvants and things from the vaccines, the diet, chemicals, flavorings, additives, colorings, gluten. You have gluteomorphine receptors in your gut that fire directly to the brain. Casein, which is the protein in dairy. So you have caseomorphine receptors that fire directly to the brain. So the first thing you do with young people with ADD, ADHD, and issues with brain fog and can't concentrate, they really have to get off gluten and most likely dairy. Many times with those kids, we used to have to run lab tests so that you'd have a hard copy of showing their sensitivity to gluten peptides so that they can go to school with this and say, I can't be on this stuff. You can put them on some herbs that will help clean up the brain, as I discussed, and you can see really dramatic results with those kids.
Doctor, quick question on that. On the green tea, do you not like the product by QN Labs?
The EGCG from them. Honestly, the only one I trust. I'm not familiar with that one.
That's Dr. Bob Marshall's.
Oh, Bob Marshall's, that would be the next best one, yes.
Okay, I thought that's the one I'm taking. Okay.
Dr. Connors?
Uh-huh.
I've been listening to various functional medical doctors about that fasting. It's not very intermittent fasting. They said there's like 6 different, stages of fasting, but anyway, it helps with the stem cells, helps with autophagy, energy, reset your DNA, turn the bad genes off and turn the good genes on. Reset your microbiome. And then the last one was growth hormones. Is that something that you want to see happen with us with the cancer? Well,
no, you don't. So that's why it's important the way you fast. That's why I stress on all our cancer, on our cancer fasting videos that, if you're going to do a straight water fast, for less than 24 hours. So you're going to just water fast today, and then tomorrow you're going to eat again. That's just fine for a cancer patient. If you're going to do a straight water fast for more than a day, so you're going to do a couple days straight water fast, that's not a good idea for a cancer patient. Is it a good idea for a non-cancer patient? Well, as long as you don't have diabetes or something like that, then yeah, you could fast for multiple days. But the difference is that one component that you mentioned, Deb. It's the IGF-1. The IGF-1 levels will stay low if you do just a one-day fast, but if you stay on a fast, your IGF-1 levels will go up, which is desirable if you don't have cancer. But is not desirable if you have cancer. That's why we recommend either the intermittent fasting, so you're not fasting more than a part of a day, or the fasting mimicking diet. So the fasting mimicking diet, you don't have to worry about that at all. And you're going to lower IGF-1 levels. You're going to lower that growth hormone factors. You're going to lower mTOR, which is the replication piece, and that's what's going to be best for cancer patients. Is the fasting mimicking diet best for an athlete who's training for the Olympics? No, maybe not. Maybe doing a 3-day fast and going on a more ketogenic diet is going to be best for them. So yes, it is different with cancer patients, and it has to do with the IGF-1 levels.
So if you're fasting like 14, 16 hours a day and 2 meals a day for us, for the cancer patients,
you're fine then.
That's a good one.
Yep, you're going to be fine then.
All right. Just you said you consider that a keto-like diet.
Uh-huh.
It doesn't put us totally into ketogenesis, but it gives us some ketos to burn.
That's right. So it's lowering your total glucose levels.
Okay, and then you still want us to monitor the glucose, correct?
That would be best, yes.
And keep it what level again?
Well, anywhere between 65 and 85 would be good.
Okay, thank you. And also, you were mentioning that lady before us. She was something about calcium in your blood. That has to do with bone cancer?
That does, yes. If you have high levels of calcium, that can be an indication of osteolytic activity, meaning bone is being broken down.
Since I had metastasis there, should I be checking that?
That's something that should be done pretty regularly by your doctor, is just calcium levels.
Well, honestly, I'm just doctoring with you mostly.
Okay, so we should talk about your labs then.
Okay, we had to get my D3 measured. So I go this Monday to the traditional doctor, and he's going to put me traditional totally, but I'm just going to say yes, like a bobblehead, yes, yes, yes. And then I have the Cyrex test coming into you.
Okay, are you going next Monday, you said?
The 28th, yeah.
Okay, so then ask him to do blood calcium levels.
Okay.
Okay, that'd be perfect.
Okay.
All right, I have to let you go. Our time is up. I will get this up unrecorded if you want to listen to it again. And I thank you all for joining, and we'll see you next week.
Thank you.
Thank you.
Bye-bye now.
Bye.
Bye.